Hello and welcome to Beyond the Paper Gown. I'm your host, Dr. Mitzi Crockover. Our focus here, of course, is women's health. And sometimes the conversation takes us to places many don't want to talk about, even when our lives are greatly affected. Well, today we're unpacking a topic that's surprisingly common, yet often whispered about, and that's pelvic floor issues and incontinence. Believe it or not, it's something that impacts over a quarter of women in the United States at some point. Whether it's due to having children, changes as we age, or even participating in high impact sports, pelvic floor disorders can result in incontinence, sexual dysfunction, and more. Good news is that we have as our guest today a philosopher turned inventor and entrepreneur who, because of a personal experience, felt compelled to do something for women struggling with pelvic floor challenges. Dr. Stephanie Schull is here to talk to us about her journey, her insights, and her product. And just a reminder that this podcast is for informational and educational purposes only and should not be taken as personal medical advice. We encourage you to discuss your specific issues with your healthcare provider. Today, we have a very special guest that is going to talk about something that many of us don't like to talk about, and that is incontinence and pelvic floor issues. And with us is Dr. Stephanie Schull. Stephanie, hi, welcome.
Hey, Mitzi, thank you for the invitation.
Oh,
Always wanted to be on your show.
oh, well, it's great to have you. And just so that our audience knows who you are and what you do, give us a little bit of an introduction.
Sure, yeah. So, Dr. Stephanie Schull, but I'm of the philosophy professor variety of doctor, not medical doctor. So, let me say that straight out. I won't, maybe I should skip the speech about how philosophy is the queen of the sciences and we started it all, but uh, humble brag there about us.
I have a art history teacher who basically schooled us in exactly that PhDs are the real doctors. Doctors means to teach.
I was a professor for a few
There
decades,
you go.
and then I also did university administration, where I found out I'm kind of good with the business side of things. But my insatiable curiosity led me to be the director of the Frank Lloyd Wright School of Architecture, where I was around a bunch of architects and makers and doers. And one day when I found out that my mother had been crippled by these pelvic surgeries, crippled with she's going to be in pain for the rest of her life
Mm.
from surgeries that did not go well, trying to address pelvic floor problems. I got to researching and I decided to roll up my sleeves and see if I could do something about it. You know, it's But it quickly became bigger than just my mother. I immediately realized the scope of the problem was so vast that I felt like I needed to stop doing armchair feminism in academia and start doing, applied feminism, as I like to call it, getting out there in the world and seeing if I could, help people's lives. And so I thought to give it a try after being around all these people making things. And I invented a device and I pursued manufacturing it and then retailing it and trying to get it out there in the world.
Terrific. And we're going to talk much more about that. I don't think I asked you, what's your PhD in?
Philosophy proper.
Philosophy proper. What's improper philosophy?
Yeah, everything else. No, no, I mean, philosophy is great. And I was just not that long ago at a dinner with the president of ASU. You probably have met
Dr.
him. He's
Crow, yes.
a marvelous and interesting person. And someone asked in the room, "Hey, what's the best degree to get to be an entrepreneur?" And his answer was philosophy. I mean, right?
Yeah,
Incredible.
there you
I
go.
think second and third was tied with like engineering and economics on his list. But I just was, captured with that answer. And so I just basically am always curious and want to be learning. And so jumping into medical devices was like endless learning. Endless possibilities to not know something and then learn about it and then try to master it, which is, I think, just a wild ride that I love.
let's tell the audience about what your device is and what it does.
Well, thank you. Yes. So, pelvic floor problems was what got me started. And I was surprised in my mid 40s to find out that there's such a thing about pelvic floor and that there are problems with it. I mean, that's how I started out really at zero. But the shock of it as a woman, finding out that the majority of women around me, unbeknownst to me, were secretly struggling with problems of incontinence, of organ prolapse, of sexual dysfunction that were holding them back from living life as they wanted to, like blew me away. And then I think maybe it's probably as a philosopher, the fact that taboo, meaning our belief system and our prejudices that aren't grounded on reason or logic, kept us from solving the problems and talking about the problems, like animated me even more to do something about it. So I think it's precisely that was taboo that I got so ticked off that I said, no, no, no.
For our listeners, describe what the pelvic floor is, because you said you didn't know what, these kinds of conditions were.
Mhm.
I don't think many folks even know what a pelvic floor is.
Yes. So when we think of like the genital region, we think it's hair and skin down there in a pedestrian way, just, person on the street. That's what we're concerned about, or that's what we think of it as. But it's actually this intricate architecture of muscle. And those muscles have many important jobs. Again, I did not know how it all was tied together. And so, sure, a lot of us walk around with atrophied muscles. By that, we mean weak muscles. And okay, so we can't lift as much in the gym, or we can't, do certain jump very high, or whatever the thing may be. But when pelvic floor muscles are weak or atrophied, a lot of important tasks kind of go offline. And so, how one would know if one's muscles are weak or atrophied is they would start to sense or see some bladder leakage when they laugh, cough, jump, walking downstairs, exercising, all of those kind of high impact moments throughout our lives. And then they would eventually, Mitzi, no one wants to talk about this other thing. I find people are okay talking about bladder leakage, but people are hesitant to talk about gas leakage and fecal leakage, which aren't far behind.
Sure.
Pardon the pun. They are there,
Just got that.
ready to happen next, since it's the same network of muscles. And so fecal leakage and gas leakage also possible with those same types of events. And then there's the dropping of the uterus, the rectum, and the bladder, which I find nobody talks about. I mean, you'll hear someone after the fact say, "Oh, I got a bladder lift," or "I had a hysterectomy because my uterus was dropping." But no one, I've heard that, but didn't add up what that meant, what was going on. Why is it dropping?
Right.
What makes it drop? And, if in a large part, if the muscles aren't toned and holding it up, in many cases, they won't drop, or they can be corrected whilst dropping if it's not too late. Um, and then the sexual dysfunction is so fascinating. So there are many ways pelvic muscles relate to sexual function. Many, many ways. I'll put on the list laxity. Now, I have trouble putting that on the list. That's why you heard me hesitate. I don't think laxity is actually a problem. A woman could have loose or a vagina or lax muscles, not a problem for her. But the reason why I put it on the list is if she's not confident or insecure about it, or it keeps her from saying yes to events that she wants to say yes to, then I consider it a sexual dysfunction. And that's just, and she may have a partner who's not very kind, and that may be a source of trouble for her. So I put it on the list. But laxity is when the muscles are so loose or lax that creates that phenomenon. But there's also vaginal dryness. Yeah, vaginal dryness could have other causes, medicine, dehydration, other things, hormones. Um, but it could also be if the muscles aren't toned enough to be that sump pump, and if the blood flow isn't there to get that moisture to the surface. Sidebar, I was dry throughout my 40s, thought it was just a thing that I was going to live with for the rest of my life, thought I was addressing it with artificial lubricants, which, by the way, I never found a good one for me. They always irritated me or disturbed me in some way. But in the process of inventing my device, my lubrication came back, Mitzi.
Hmm. That's fascinating.
I don't have any artificial lubricants anymore. I don't
Huh.
need them. And I had like 15 because I was looking for one that didn't bother me.
Right.
So my cupboard was full, but now I don't need any. So dryness, which is not often thought of as being related to pelvic muscle tone, I wanted to put that out there to raise awareness because your crowd can go into the detail and into the nuance. And then probably obviously, or maybe not obvious, nothing's obvious in this, anorgasmia, the difficulty reaching climax. And so orgasm seems like this magical event, this mysterious happening, but underneath it all, it's a muscle contraction.
Right.
It's powered by muscle. And so if our muscles are toned and responsive, they can achieve climax more easily, which means, more positions. And then the quality of the climax is more interesting. So even if we don't think we have pelvic floor problems, we may be slightly held back in ways that we're not yet connecting the dots on, and the origin may be pelvic muscle weakness.
I've not heard that expansive of a discussion about pelvic floor weakness, so thank you for that. And I think that that's going to open up a lot of eyes. So you talked about what happens when you tone the muscles. Is there something that one can do to prevent it?
Yes. So prevention would be to keep the muscles toned. So you ask yourself, how do you keep muscles toned? Well, hormones do a certain amount of work to make it easier to keep them toned. Whatever exercise you're doing is more effective when hormones are feeding the muscle and making that more productive. So when we reach menopause, yes, it is harder to keep that muscle tone, much like we're all kind of aware that, or we will be aware eventually, that when you hit menopause, you have to spend a little bit more time in the gym to get the same results that you did
Mhm.
before more easily. That's true with, the atrophy of the pelvic floor. And so I think it's best just to think of it, once you learn it's muscle, just think of it intuitively like you think of any muscle group. So how do you keep it toned? Well, there's a range of movements and exercise. Pilates is known as being one of the best for keeping the pelvic muscle toned. Yoga is also known. Orgasm itself is an exercise. So if you want to use a vibrator toward that end, or however you want to reach that alone can also keep those muscles in good tone. And so my device was intended to help people make it more effective and easier and less time on task to exercise those muscles. I would argue that using something like Kegelbell would even enhance your time trying to exercise through orgasm because it will improve that experience as well, and also prepares you for those types of exercises.
Wanted to ask about causes of uh, issues like prolapse and
I see. Yeah.
incontinence.
Thank you. Right. What causes it? So there's a range of causes. That's the complexity of this. And that's why I'm so glad we have this long format to discuss it, because it doesn't fit a 3-second commercial soundbite. What can cause it is girls and women at any age, if they practice basketball, volleyball, gymnastics, marathon running, heavy weightlifting competitions, all of that puts a lot of pressure on the pelvic floor. And if the muscles don't have the endurance or the counter strength to counter that, they will encounter leakage. When I was just in Japan talking with a soccer player who is now going to take Kegelbell to the soccer team, the professional soccer team, to discuss it because it's a problem for them, even though they're in the peak health, obviously, as professional football players.
So, I'm thinking as a mom of two girls, and
Hmm.
again, well, one of them was very active in basketball. Should we be thinking about discussing this with our female athlete children?
Yes, please.
And
Yes.
what should they be doing?
Yes, I think that is so. Thank you for bringing that up. Please have discussions with your young children, if they're girls and they're practicing sports, about leakage and why and how it happens, because they are so proud of their bodies and they are, it's one of their strengths. And then it's all the more humiliating that they have these accidents. And then they start to hold back in their sport, trying to avoid those explosive movements that create it, which keeps them from competing at the highest level. And then the third worry is they drop out entirely because they're so embarrassed and don't want to manage it anymore. And they stop the sport entirely. And there is information and studies out there if people want to Google women dropping out of sports because of incontinence. But yes, and but how to encourage them to solve it? We can describe to them how to do Kegel exercise. Like
Sure.
you're going to need to create muscle endurance to counteract the forces that you're encountering as a high performance athlete. So we can just encourage them and then also let them know, hey, it's just because you're so awesome and you're doing these massive jumps and these massive, things that you're getting some leakage. But yeah, I would encourage them to understand it. And then if they can, strengthen the muscles so that their bodies can endure the high impact nature.
So you mentioned the term Kegel or Kegel exercise.
Mm-hmm.
I'm sure many of our audience know what that
Mm-hmm.
is, but for those who may not, could you explain that? Because that's certainly a big part
Yes,
of the name of your
it
device,
is.
the Kegelbell.
Yes. So Kegel exercise is a first line treatment, according to medical professional associations in America, for treating incontinence and sexual dysfunction. And it is easy to describe. It's wonderful. It's in a couple of sentences, which I can do. It is to contract the muscles of the pelvic floor, inward and upward a few times, 3 times a day. So to do it like for a few minutes, 3 times a day, every day for the rest of your life. So the idea is to integrate exercising the pelvic floor 3 times a day, every day for life, is to say it's a part of the body, it's a muscle group, and it needs to be activated to stay healthy. And so it's easy to describe. Doctors prescribe it. However, the diverse medical studies show that about 25% of women get it right, which is great news. 1 out of 4 of us get it right and get the benefits. They get the protection and they get the treatment and they get all the prevention and all the good stuff. However, that means 75% of us aren't getting it right because either we're not doing it at all, or what actually happens quite a bit is we think we're doing it right. But why would it be so easy to describe? Contract those muscles up and in, relax them, alternating, for a few minutes, 3 times a day, activate them. Why is that so hard? Well, the muscles are atrophied and it's really hard to target an atrophied muscle group. So women activate their thighs or their buttocks or their stomachs. So they think they're doing Kegels, but they're not. And so they get frustrated. They go to the doctor and they say, I'm doing it. And the doctor says, well, but there's no improvement in tone. And everyone's kind of wondering what's going on. Let me add a layer from like a philosophy professor. I also studied philosophy of psychology when I was at it. That taboo and how we were taught as children cut us off from our mind-body connection a long time ago. And so what it looks like is this, and maybe this also has something to say about how we raise our children and how the audience may think about the conversations they have with their children. When we kind of energetically say to our children, don't look, don't touch, we're in public or something, or whatever the case may be, we have anxiety around them looking or touching the genital region. Good little girls, which most of us are, take that message very seriously. And we are like, oh, what bad things are there? And we cut off unconsciously and otherwise. And so there's a disconnect mind body. And when doctors tell patients to Kegel, well, Kegel what? The connection's gone. And that's partially, a big part of why I invented Kegelbell. It's a biofeedback device that helps people reconnect and sense those muscles. And it takes the guesswork out of it because it makes it a reflex.
So talk to us about, you've got 25% of women doing it right, the Kegel exercises, but then those 75%, and again, I think it's really interesting. It's almost worse if you don't know what you don't know, right? So they think that they're doing it right and don't know. So what is the Kegelbell and how does it work and how does it answer this problem?
Mm-hmm. Yes. So the Kegelbell has 2 parts to it. First of all, it's a mechanical device. It doesn't involve batteries, electronics, or apps. And I made it intentionally that way to keep it simple, to reduce friction in using it, and so that could be easily sold around the world and help women everywhere. So basically, there is an internal portion, which is inserted into the vagina like a tampon would be. And the woman is standing while using this. And she uses it for 5 minutes, about 3 times a week when she's building muscle. And then when she's happy with her muscle tone, she can reduce that to once a week just to maintain muscle tone. So what we've done is we've reduced the time Kegling. So she doesn't need to do any other Kegel exercise if she does not want to. And we've increased the effectiveness by putting the weight outside the body, which is the second part of the invention. It's externally weighted, and it's externally weighted on a dynamic elastic cord, which those people listening, maybe they have a hard time in visualizing it. There's a small egg-shaped tampon-sized bulb. There is an elastic cord, and from it is hanging a weight. And that weight is wanting to pull it out of the body when you're standing. So imagine you have the insert in, maybe you've really lubed it up to make it slippery, and it's going to want to slip right out. And the weight is dragging it out. Gravity's doing its work. And here's where you don't have to think about it. If you just say, body, hold this in, that's all you have to do is think, body, hold it in. And because your legs are apart and you're not cheating by squeezing your thighs together, your legs are apart, the right muscles will squeeze up and in to hold it in. And that is what makes it so effective, is you're triggering the right muscles. Otherwise, it will fall out. So you have that immediate biofeedback. And then here's the genius part of this little device, which is that dynamic weight. So movement is then, and any bouncing, if you do with your knees, is communicated to this, and it moves around. So it gets the fast twitch muscles as well as the slow twitch muscles, which an internally held weight will not do.
Wow.
And it's the heaviest vaginal weight, and it's the most customizable. So here's, the thing is, we put in 2 insert sizes, a larger one postpartum perhaps, maybe just people start at different places with different levels of laxity. Some women, Mitzi, you're going to find this interesting, the larger insert will still immediately fall out while standing. Immediately, they can't hold it even for a second. And so there we have instructions that they would lay down, insert it, and gently tug on the cord, resisting it coming out. And in about 2 weeks is a kind of a fortnight, is a kind of an interesting time period in medicine. Maybe you would agree that the body can do lots of things in a 2-week time frame.
Sure.
And it seems like 2 weeks is where you say, test to see if you can stand up, and you'll be able to hold it in. Also, when I tell them, by the way, if they're laying down, is to do like a finger test, which is because we've lost that mind-body connection.
Right.
So I'm like, okay, insert a finger and tell yourself to squeeze. Now keep that finger inserted. Now cough. They may notice that they have a stronger response autonomically, without, unconsciously with a cough than they would consciously with a command. And then also, put a finger in there while you're laying down and feel your muscles squeezing. We're trying to retrain the body-mind connection and through that biofeedback. So that's basically how it works. And we give them, Mitzi, in the kit, the original kit, there's 8 combinations per insert. So what that is they get like 30-gram increments, from 30 grams up to like 240 or so grams. And that gives them, when it gets to be easy, Mitzi, they just go up a level in weight.
If I was someone who looked at this for the first time and I see this weight and I think about, is it painful?
Mm-hmm.
Could I hurt something? Could I tear something? I'm sure you've gotten some of those questions, so I want to have you have an opportunity to answer them.
Yes, yes. Contrary to being painful, it's pleasurable. So there's that. Okay. In fact, I don't know how cheeky to be or how much to reveal in my own marketing. Maybe I'm doing it all wrong, but It's pleasurable. To me, it leads into a self-pleasure session because it's the same muscle group.
Hmm.
It kind of, I mean, if you don't want it to, just want to be very businesslike and get this done in the shower and be done with it, sure. But it is pleasurable. And in our counterindications, it says if you ever feel pain, stop using and see a doctor. And also, if you have pre-existing pelvic pain, do not use it. Now, if their pre-existing pelvic pain is because they have hypertonic muscles, I mean, it's not going to hurt them. They're not damaged by anything. It's just not going to necessarily help them. But so to answer the question, is it painful? No. If it is painful, if inserting this inch-long device and holding it in is painful, there's an underlying issue.
And who is this intended for? Is it specifically for incontinence, or are there other reasons why women might use the product?
Okay, so that whole constellation of issues of the varieties of incontinence, the varieties of organ prolapse, the varieties of sexual dysfunction, they can all have the same cause, laxity.
Mm-hmm.
And therefore, Kegelbell, as you can tell, it's a weight system. Laxity will not be the problem if you use Kegelbell properly. And therefore, those problems should go away, assuming their cause was atrophy, right? Anorgasmia. If the cause is atrophy, it should go away. If there are other issues, like psychological issues or things like that, then it won't necessarily address that, right? But it will if it's atrophy, for sure. And, there's also a whole, I forgot to say at the time because the list is so long, but I want to say it here because when I was in Japan, Mitzi, this was the one symptom that I got the most traction with when talking with the audience. And I didn't even mention it here, and that is constipation. For some reason,
That
that was
is a
socially
huge
acceptable.
issue.
It's a
Yeah.
huge issue, and it was socially acceptable in Japan to discuss, whereas sexual dysfunction, I could not.
Interesting.
But yeah, constipation can have other causes. If it's because you're dehydrated, because of medication you're taking, or because you don't have enough fiber, those need to be addressed. But assuming that's all okay, and it's really your muscle atrophy isn't pushing it out. So pelvic muscles have to hold back, but they also have to push out. And so constipation is interesting.
Are you FDA approved or cleared?
Registered, FDA
Registered.
registered.
So you can only, I know that you have to be very specific about the claims that you make.
I
And
am.
so at this point in time, what are those claims right now?
Yes, I can say that it's a Kegel adjunct device. So everything that Kegel exercise is known to help with, this is an adjunct device. And I can say it treats female sexual dysfunction, FSD.
Okay.
And
But
those encompass a satellite of things, constellation of things. And so then it's, diverse range of things.
okay. So that includes incontinence then?
Incontinence. So Kegel exercise is considered a first line treatment for bladder leakage and incontinence.
So is there any condition that women should not seek out Kegel exercises or the Kegelbell?
We have on our list if they've had surgery recently that they need to heal, if they've given birth, they need to heal.
Right.
They need to count themselves out if they have active pain because there's an underlying issue and that needs to be resolved. And I tell a customer, if you don't see changes in 2 weeks, we give you your money back and we encourage you to see a pelvic floor physical therapist.
Let's get back to that conversation about causes. So,
Yeah.
that the one about the female athletes was really fascinating and something I did not know. Other causes of pelvic floor disorders.
Yeah, I want to kind of go in the age range. So starting with youngest. So we talked with athletes. Obesity can also create that problem at a young age as well. So you have a lot of weight on the pelvic floor, and that downward pressure, keeps that system from working properly, and they could start to have those symptoms. Um, so the bladder leakage is probably the most noticeable symptom a young woman would have due to obesity. And then chronic cough. So if you have asthma, if one has a chronic cough, that explosive action repeatedly can lead to that kind of problem. And then childbirth. Well, the weight of carrying the baby, even if you have a C-section, can create the problem. It's kind of like temporary obesity, if you will.
Mm-hmm.
And then delivery, of course, as we know, and the recovery process of just the body going through that, carrying the weight, the delivery. Uh, and so that could create some issues that are lead to laxity and weakness.
What we're really talking about is exercising a set of muscles that, again, as we talked about earlier, many of us didn't know we had and don't know we have until it becomes a problem. And by that time, it certainly can be treated, but it's much more difficult.
Yeah, and it's heartbreaking, Mitzi, when people reach out to me about pelvic organ prolapse and it's too late and they write to me and say, "Can I use your device? Will it help me to avoid surgery?" It's like, it's too late. But it's so hard, Mitzi, to tell people about the preventative story to avoid pelvic organ prolapse through exercise because it happens occult, unbeknownst to us. The organ is slipping for a long time and we're not aware of it until it's too late.
You know, it reminds me of osteoporosis too. And
Mm.
again, having two 20 something daughters and realizing that this is the time for them to be building bone. This is the time for them to be strengthening their pelvic floor. And again, the 20-plus-year-old may hear that, but obviously it's a lot easier to think about than it is to actually go and do, especially if you don't see it in your very near future or it's not bothering you at all. But it seems like this is an opportunity to get those messages out.
I'm curious that we obviously don't have the discussion with our children. By the way, I'm childless, so I'm just speaking in the abstract here, um, because we don't know ourselves. But let's say someone's listened to this podcast and now they have the knowledge. Why would we hesitate to speak with our children about it? Well, the conversation we've been having or society has been having is one that I think implicitly, if I can get nuanced here, implies that that part of the body almost is for other people. It's for your partner, it's for your doctor. That's why they're not looking at it. Who looks at it? The doctor looks at it. Who's when we don't talk about it because it's for when you're intimate later, which involves another person usually. And I think the conversation would be healthier going forward once we're all educated and know more, is that it's your body. Here's what you need to do. You brush your teeth, you shower. Okay, you need to take care of that part of the body. It's yours. And now they own it. It's part of their sense of self-awareness. And then they don't have the mind-body disconnect. My forward-looking thought is I'm curious if we can reach a time where we educate our children to just think of the pelvic floor as part of their body, part of their self-care routine, part of their health. And it isn't implicitly something that is for others or that only the doctor can know about, which is to remove their ownership and their sense of self.
Couldn't agree more. Have you experienced, with respect to marketing your product, any obstacles with respect to not being able to advertise on certain media or any other kind of censorship?
Yes, the censorship has been intense across all social media.
Hmm.
It's been an obstacle. It's kept me from reaching people and helping educate people. It's really a problem.
Do you feel like the censorship has impacted on your ability to sell your product?
Yes, the censorship unequivocally has impacted my ability to sell product. So therefore, it's also overall, I know, impacting our ability to communicate with people and educate them about their health. What is women's health? It's however we're different from men. How are we different from men with with sex characteristics? Genital health, um, and our inability to discuss that means that we can't discuss women's health.
Well, first of all, what do they cite when they say that you're
Mm,
violating
yeah.
the policies?
They say it's adult content. By adult, that's a euphemism for, they think, lascivious sexual content. They say I'm talking about, nudity or sexuality. If I try to show a model of something, yeah, the language itself, if I try to say treats female sexual dysfunction, I get pinged on the word sexual. If I try to say anything about the vagina, which is the medical term, I get pinged on using the word vagina. And what's so interesting is I remember early days like Facebook, I would put out these ads or even posts, but ads, let's say some ads. I would get these click through rates that were insane, bonkers. I have screenshots of it. No other, when you're targeting with marketing people, no one saw those numbers. And then it would be shut off for violation. So what was happening is people were hungry for this information. They were clicking on it like crazy, but the censor said no.
You've been very generous with your time. What did I not ask you that you wanted to make sure that you shared with our audience?
Well, I'm trying to get this to go global, Mitzi. When I invented this, I had in mind women everywhere.
Mhm.
And I really had this visual in my head that I can't shake. Arranged marriage is still one of the most dominant forms of marriage in the world. And I
Mm.
imagine a woman who doesn't have maybe necessarily an understanding husband. And these symptoms can lead to abuse, neglect, abandonment, where she doesn't have the ability to sustain herself. You see what I'm saying? The picture I'm trying to
Yes.
paint.
Mhm.
And I wanted to get out to her and help her. And so that's been a big part of what I'm up to. And I made a device that actually, Mitzi, I just launched on Walmart.com today.
Oh, great. Okay.
As we're taping this, it's today. And it's a more accessible price.
Mhm.
And this is the one that I'm trying to get out into Africa and Asia and Latin America. But hey, we have a lot of poverty in America. A lot of people that can't afford, you know, Kegelbell, the original kit. And so I have a device that replaces the external weight with a bottle cap adapter.
Say more about that.
So the external weight was that game-changing feature that made it very effective and very different. But it's expensive to make the weight. It's very expensive to ship the weight. Shipping costs are going through the roof. So I can replace the heavy external weight with a little bottle cap adapter, and that allows her to screw it on to any standard water bottle anywhere in the world. It's a pretty universal bottle cap adapter. And then she provides the weight, but it also allows her to customize it like
Hmm.
infinitely, a drop or a liter. And you asked me earlier, were there any problems or worries? You know, if it's too heavy for her, it just falls out.
Hmm.
So she doesn't have to like wonder about what she can lift. She can just, whatever she can lift, and she adds weight as she gets stronger. It's very organic like that. And so this bottle cap adapter allows women to be at whatever level they are of strength, grow however far they want to grow and strengthen their muscle. And they can do so with lower costs, and it's just also a nice travel version for women with any, income level, because you just have to travel with the bottle cap adapter. So I'm really excited to get that out there. It's brand new. It's on walmart.com right now. And it's also something that I'm trying to get into lower income environments around the world. So let's see what happens with that.
Absolutely. Well, we will have all those links in our podcast notes. Dr. Stephanie Schull, this has been an enlightening conversation. So thank you for your work and your creativity and for your time today.
And thank you for giving us a chance to have these long form conversations with people around the world.
And that's a wrap on today's eye-opening discussion. A big thank you to Dr. Stephanie Schull for joining us and sharing her incredible journey and insights into solving one of the health issues many of us might face, yet seldom talk about openly. If you are having any of the symptoms we discussed today, don't hesitate to reach out to a healthcare provider. There's help, there's hope, and most importantly, there's no reason to suffer in silence. And I encourage you to take this conversation back home. Talking with our daughters early on about all aspects of health, including pelvic health, can pave the way for healthy habits and even prevention of issues that they could face later on in life. I invite you to visit our website at beyondthepapergown.com for more information and to sign up for our newsletter. You can follow us on social media and leave a comment. We love hearing from you. And please rate us wherever you listen to our podcast. Thanks for being with us today and take good care. This episode was produced by Patrick Shambayati and me, and our associate producer is Kyla McMillian.